We are in Chicago. We're in the southwest side of Chicago, of a community called Little Village, or La Villita, which is 95% Mexican-American community. This event is called Esperanza Extravaganza.
And it's really helped us to expand some of the work that we're doing in terms of dental education.
Tooth decay, so early childhood caries, is maybe the most prevalent chronic condition in childhood. So for us, it's a huge condition, and we can have hopefully a good impact on it. We're super proud to be able to get CATCH grants.
This is through CATCH, the grant that we got. And so we're applying fluoride varnish to all families, not only kids, but also adults. And then we're also giving oral hygiene instructions, diet counseling, and we're trying to link our patients to a dental home. So if they say that they do not have a dentist, then we send them to all different areas.
Now we're working with the UIC, the University of Illinois at Chicago, Hispanic Student Dental Association. They are providing oral health education and dental varnishes to families of young children here in our neighborhood.
In our community, less than half our patients have a dental home, have a regular dentist. We're going to link them to a dental home. 30% of our patients have no insurance, and a lot of our patients are people who recently came mostly from Mexico, who are not familiar with the US healthcare system, are not familiar with the language, and have no insurance. So we want to make sure that anybody who comes to Esperanza for the 12-month well-child visit is linked to a dental home. We have to think on what's important for the community. We have to think, how can we implement it, something that we could easily do, and something that we could sustain after CATCH leaves. And what is the biggest impact we can make in this 6 months that we can sustain throughout the years. Making an impact takes time, right? And overweight takes time. We just have to little by little educate our patients. As an example, there's no sodas. The only thing we have for our patients is water. A lot of families believe that juice, because it's sold like if it was a fruit, it's like a fruit, which is it's much more similar to a soda.
It's like it clicks to them and say, really? I thought that juice is good for me. And they don't understand that juices, for example, can have a lot of sugar. And so this is one way to just make them aware of the diet.
So because of that, we thought it was a good opportunity to do a few things. One is to provide education to our families on Saturdays. Second is to link all of our 12-month-old and all of our 24-month-old with the dental home. So we want to make sure that anybody who comes to Esperanza for the 12-month well-child visit is linked to a dental home. We always want to be more than a clinic. We want to make sure that we're part of the community. And this is us being part of the community and bringing the community to us.
I think that there are really few opportunities for doctors to get out and do stuff outside the doctor's office. And there's a certain type of doctor who really gets excited about that community outreach, and CATCH really can give the extra push that it needs to do that. You know, it's hard to take time away from seeing patients in the office. And getting this little extra funding makes a big difference to get the doctors out, make them engage with the community more, make them really do the kind of stuff that a lot of them got into medicine for, which is preventive work and education work.